I first became involved with the Hill Country Mission for Health when my brother became severely ill. He developed acute bronchial pneumonia and he did not have health coverage, so I took him to the clinic. They saved his life. They sent him to the hospital. He had a heart attack while he was at the hospital. Had he not been there, he probably would have died. In revisiting the clinic for follow-up, I started watching the people, the volunteers there at the clinic, and I was impressed on how they handle the patients. And I lost my job shortly after that, and I became a patient because I no longer had health coverage. I had developed bronchial pneumonia, and at the time I didn't even have money for medication. And Hill Country Mission for Health paid for that. It was $200, and I really felt in my heart there was something I needed to do to repay that, for that kindness and that generosity. And through the years, I've been there 3, 4, 5 years now, I've witnessed a lot of things there at Hill Country Mission for Health that are vital to the community. I believe that without that, there would be a lot of people there that would suffer. They don't have the wherewithal to go to other communities. We don't have any other facilities there to cater to their needs and to help educate them in a better way of life, whether it be nutrition, hygiene, dental care, you name it. And there's a full scope of services that Hill Country provides there, and the volunteers there are amazing. They are kind, they are genuine. And what I mean by genuine is that each patient that goes through that door, they genuinely care about their health, and they make every effort to be there every week to encourage the community and the patients there to move on and be in better health.
Hill Country Mission for Health has really impacted my life. As a matter of fact, I think that they saved my life. I was without insurance since 2011, and they have been helping me since until 2014. They discovered that I had breast cancer, and as I said, I think they've saved my life. I would have had absolutely no health care whatsoever. I couldn't afford any health care, and without the Hill Country Mission for Health, I think that I just would have been without. I also have diabetes, so I needed that management, and I think that I just would have not been able to have any type of health care management at all. I enjoyed the Risk Busters program. They were very inspiring. I believe I saw them about every 3 months. I was coming in about every 3 months, and toward the last, before I found out that I had the cancer, I had started losing weight and really participating in that program. So I really enjoyed it. I thought they did an excellent job, and they were very inspiring. The volunteers are wonderful people. They're very helpful. Anytime I've ever needed anything, and the volunteers were here, they do everything that they can to help the patients get whatever it is that they need. If it wasn't for the Mission for Health, I would have literally lost my life. I would have not been able to find out about the breast cancer. I would have not been able to have treatment. So it's a life-saving service. I believe that I've had as good of care here as I had in the past with insurance, if not better. They're very caring, they're very kind people, and I've never had better medical service anywhere.
I had been really sick and been going downhill, but as most people do, we self-diagnose and kind of push it off to the side. And Miss Judy kept asking me if I was okay, And she'd run some blood tests on me, and things weren't quite right, which I would have not known if she had not done that. And I ended up in the emergency room, and I was diagnosed with renal cell carcinoma. And I was given about 60 days to live. The Hill Country Mission for Health, the whole group, everyone in Bernie, everyone in Comfort, they rallied around me and gave me a sense of, the Spanish word for it is ánimo, drive, wanting to. They gave that to me. they educate people. We educate people to live healthier, happier lives and give them the drive, the animo to do just that. I think that is one of the largest contributions that the Hill Country Mission for Health has to comfort, is that they give them hope. I believe this is a faith-based ministry. I think it's an accumulation of a number of different people from different faiths coming together to promote one good cause. And I think God's hand is behind all of it. I think He's brought us all together to minister to each other as a community. I've seen His hand at work in so many ways. I've seen our group rally around each other in prayer. I have seen miracles through that prayer. And then where God has deemed necessary, then they have to go through the medical process. I believe that God does perform miracles. I believe that Hill Country Mission for Health is a miracle.